Welcome back to the Healthy Care channel. Today, we're diving deep into the crucial topic of HIV treatment and the essential team that supports individuals on their wellness journey. Building a robust HIV treatment team is vital for maintaining good health and preventing the progression of AIDS. Primary HIV care provider. At the forefront of your HIV treatment team is your primary HIV care provider. This leader, whether an MD, DO, PA, or NP, plans your treatment and monitors your progress. Choosing a provider you're comfortable with is key, as they become your main point of contact for an extended period. They prescribe necessary medications, such as antiretrovirals, ensuring you stay well for years. If your primary provider isn't an infectious disease expert, they may refer you to one. In contrast, a general doctor may address additional health issues and preventive care. Infectious disease specialist. An infectious disease specialist is trained to diagnose and manage infections like HIV. They also monitor for other infections common in individuals with HIV, such as hepatitis C, tuberculosis, and specific pneumonia types. This specialist may lead your HIV care team or be referred to by your primary care doctor. Nurses and medical assistants. The backbone of your healthcare team, nurses, and medical assistants provide and coordinate care during doctor visits. They may conduct tests, including blood samples, contributing significantly to your overall health management. Pharmacists. Collaborating with your HIV team leaders, pharmacists develop medication treatment plans and address questions about drug safety and side effects. They play a crucial role in your well-being, even offering vaccines like the flu shot, essential for individuals with HIV. Mental health provider. Recognizing that HIV treatment involves both body and mind, your team should include a mental health provider. Counselors, psychologists, or psychiatrists offer emotional support and suggest ways to manage mental health disorders, prevalent in about 6 in 10 people with HIV. Nutritionist/dietitian. Smart food choices are paramount for overall health, especially when battling a serious infection like HIV. A nutritionist or dietitian can help create a meal plan providing essential nutrients for your immune system. Dentist. HIV can affect oral health, making regular dental checkups crucial. Dentists help prevent tooth decay and infections in the mouth, teeth, and gums, addressing potential life-threatening issues in individuals with HIV. Social worker. While not a doctor, a social worker supports you with concerns related to living with HIV, offering assistance and teaching coping strategies. Often referred to as patient navigators, they play a crucial role in holistic care. Case manager for individuals dealing with the complexities of HIV. A case manager helps coordinate various needs, from insurance benefits to housing and mental health services. Research shows that having a case manager increases the likelihood of regular doctor visits, a critical aspect of staying healthy with HIV. Other team members. Your HIV treatment team may also include professionals providing spiritual care, substance use/abuse counseling, and transportation assistance, ensuring a comprehensive approach to your well-being. Assembling your HIV treatment team is a crucial step towards a healthier tomorrow. Remember, you don't have to face HIV alone. A dedicated team of professionals is ready to support you at every step. Stay tuned for more insights on health and wellness on the Healthy Care channel.